Hey everyone, Dr. Ben Canada here. I want to thank every one of you for making B&B the fastest growing INBDE Part 1 board review material. We are excited to be rolling out new material, making your study experience even better. I want to take a few minutes and walk you through one of our new resources, the B&B PFO Diagram. You can see detailed instructions on this in your sketchbook, but I want to take a few minutes and show you how awesome this diagram is when applied to questions. As we move to questions, something I want to emphasize is B&B has 100% original content. As we created this and tried to explain things in a clear and concise manner, this is what drove us to create the B&B picket fence overlay diagram. You all are very familiar with the standard picket fence diagram. It can get you to the answer, but watch anyone studying this stuff as they shift their jaw, they point at teeth, and then they develop TMD as they go. I've been there. I remember my jaw hurting walking out of the exam. The picket fence does a good job of tooth-to-tooth relationships, but you have to imagine individual cusps each time, and then you add lateral movements, and it's an even bigger stretch. Let me show you what I'm talking about. Let's look at some questions. Let's start looking at a question about contacts. This question is asking about the maxillary first molar, that mesiolingual cusp. Yes, you can answer this with your picket fence diagram, but if we look at the picket fence overlay, locate that maxillary first molar. We see the mesiolingual cusp right in that central fossa there. It's between the mesiobuccal and distal buccal cusps of that mandibular first molar, and it becomes very evident where that hits. That's all good and well. It becomes a lot more complicated when we look at a movement question. Looking at this segment, we can see that we're still talking about the mesiolingual cusp of the maxillary first molar. We just identified that from our occlusal contacts. You see how easy it is when we use your picket fence overlay diagram to answer this. We know this is the central fossa of the mandibular first molar. Remember, the maxilla is stationary as the mandible moves. The mandible is shifting to the left to create these arrows. These teeth are on the right, making this the non-working side. So this is a left lateral shift on the non-working side. Something to note, anytime we're looking at the mandibular arch, when you're looking down on the mandible, you're going to have an escape cusp pathway in your question. The mandibular movement is always in the opposite direction. Make sure and note that, and that's always going to be true looking down at the mandible because it's the one moving. Let's take a look at another way they can ask the movement question. In this case, they're asking about a specific cusp. We're looking at the mesiobuccal cusp of a maxillary right first molar. So we're out in space now, looking down at our PFO diagram. We're looking at a left working movement. So the jaw shifting to the left. Remember, our escape cusp pathway would always be in the opposite direction of this arrow. So it's moving, the escape cusp pathway would be moving out in this direction, out in the space. It's not going to pass through anything. Similar question, let's look at the mesiobuccal cusp of the maxillary right first molar with the jaw moving in the opposite direction. So now we're looking at a right working movement, and you can clearly see that the facial groove of the first molar is what this cusp would pass through. Really simplifies things. Always remember that looking down on the mandibular arch, these arrows are going to be pointing in opposite directions. The escape cusp pathway and the direction the mandible is moving. All right, now let's switch gears and pull out your maxillary picket fence overlay diagram. We're going to look at a occlusal contact question there. This question is asking about the mesiolingual cusp of a mandibular second molar. So if we identify that mandibular second molar on your maxillary PFO diagram, you'll see it lies right in that embrasure space to the lingual between the first and second molar. These questions become a slam dunk when you have this diagram sitting in front of you. Let's add some movement to that contact question. Let's stick with the second molar in this question. Now let's look at the mesiobuccal cusp of that mandibular second molar. We can see it's going to occlude right on that mesial marginal ridge of the maxillary second molar, and we can see that this produces a right lateral movement on the working side. Remember, the maxilla stays fixed. The mandible is always the one moving. We're looking up at the maxillary arch, so your right and left, make sure you identify which side you're looking at. And make sure and note that this is the opposite of the mandible. Remember, in the mandible, the arrows went in the opposite direction. When we're in the maxilla, the escape pathways and the mandibular movement arrows always point in the same direction. Always remember that. Looking up at the maxilla, the pathway arrow and the movement arrow are going to point in the same direction. So let's take a look at one more movement question. You can see at this segment, we're looking at the same cusp, but now the mandible is moving in the opposite direction. It's moving to the left in a non-working motion. The big thing to note here is that looking up at a maxillary segment, the arrows are always in the same direction. Put this diagram to work. It's going to incredibly simplify your life, and I think it's going to be an awesome tool for you guys to use. Well, I want to thank you again for choosing B&B. Now go dominate your boards.